Hi, my name is Carly Rotundi. I'm a current senior at Texas A&M University, Kingsville. I'm currently taking Dr. Price's class, English 2314, which is technical writing. Today we're going to be going over our voiceover assignment for our technical report. I chose to write over wildlife diseases and the importance of public awareness. Wildlife diseases pose a significant threat to biodiversity, public health, and global economies. From zoonotic spillovers to ecosystem imbalances, the impact of pathogens in wildlife populations is large and complex. This report will explore the causes and consequences of wildlife diseases and puts the emphasis on the necessity of and for public awareness. Through a thorough examination of case studies and current research, the report highlights the connection between animals, humans, and environmental health. It also advocates for a One Health approach to mitigate future risks. The paper also highlights why proactive management is so important for humans and animals alike. Some of the objectives is to explore the knowledge of the public about wildlife diseases, and it's also to inform the public about wildlife diseases in general. So just some background information. Wildlife diseases are illnesses that affect wildlife. There are many pathogens of the causes of wildlife diseases, which we will get into later in the paper, but some wildlife diseases can be transmitted to humans. Not all of them, but a lot of them, surprisingly. It's hard to determine how many people are aware of wildlife diseases due to the lack of surveys, the lack of documentation, and it's hard, especially really anywhere, but especially in the U.S., because it's not something that is publicized as much as other things are. Some of these diseases can have lasting and devastating effects on wildlife populations, and it also causes a threat between animals and humans, just on the health aspect of things. So the health of wildlife populations is intrinsically linked, or is basically linked to the health of ecosystems and human communities. The emergence and reemergence of infectious diseases in wildlife has raised concerns globally due to their potential to cause ecological disruption and cross-species transmission. This includes zoonotic diseases. Understanding wildlife diseases is a scientific and conservation imperative. Okay, it's imperative to be talking about these things and to understand them because it is a public health priority. Wildlife or zoonotic diseases are caused by the transfer of pathogens between animals and humans. Over 75% emerging diseases originate in wildlife, and that is from Ansel, which is one of my references. A variety of pathogens includes viruses, bacteria, fungi, parasites. All of these things cause wildlife diseases. And below, I'm going to read y'all some of the common wildlife diseases. Chronic wasting disease, which is, for short, it's CWD, typically in deer and elk. White nose syndrome, typically in bats. Avian influenza in birds. Rabies in all mammals across the board. And I practiced how to say this, and it's been a rough time. I'm not even gonna butcher that. But in amphibians, that is a common wildlife disease. These diseases have devastating effects on wildlife populations, and they also might have threats to affect domestic animals and humans as well. Approximately 75% of the emerging infectious diseases in humans are zoonotic, originating from animals, particularly wildlife. Some examples including SARS-CoV and SARS-CoV-2, which is COVID-19, the Ebola virus, and the hantavirus pulmonary syndrome. Wildlife diseases. Some common wildlife diseases, obviously chronic wasting disease like we talked about, white nose syndrome, avian influenza, rabies, the name amphibians. So also I added some common wildlife diseases in South Texas. Anthrax, rabies, chronic wasting disease, influenza, avian influenza, white nose syndrome, and rabbit hemorrhagic. I also practiced that one. That was a little easier to pronounce. But rabbit hemorrhagic disease. The close interaction between humans and wildlife through activities such as deforestation, wildlife trade, and encroachment into natural habitats increases the risk of pathogen spillover. Pathogen spillover happens when populations with high pathogen prevalence contact a novel host. It's important to note that some of the ecological impacts these diseases have. Wildlife diseases can lead to population declines and extinctions, which affects ecosystem services like pest control, pollination, and seed dispersal. From an economic standpoint, wildlife disease outbreaks can impact agriculture, tourism, public health. For instance, the spread of avian influenza has led to significant losses in the poultry industries worldwide. So, some literature review. I looked into some cases over white nose syndrome, the Ebola virus, and even COVID-19. And so the overview of those studies are as follows. So white nose syndrome, this fungal disease has decimated populations in North America, the mortality rates exceeding 90% in some colonies. Bat populations have been declining, and there's speculation pointing to the ecosystem stability and insect control. Ecosystem stability is extremely important for bats, especially because they are nocturnal. When there is food scarcity for bats, it is detrimental and has long-term effects like the dying population. For the Ebola virus in Central Africa, the Ebola outbreaks have been linked to the handling of brushmeat and close contact with infected wildlife. These events not only led to human fatalities but also affect the local economies and wildlife populations. Quoting the World Health Organization on the Ebola disease, this virus can get into the human population when people have close contact with the blood, secretions, organs, or other bodily fluids of infected animals such as fruit bats, chimpanzees, gorillas, monkeys, forest antelope, or porcupines found ill or dead in the rainforest. The COVID-19 pandemic, through the exact origins, remains under investigation. So the SARS-CoV-2, or COVID, is believed to have zoonotic origins. The pandemic, under scoping, has had repercussions of inadequate surveillance and public health preparedness. And as we all know, COVID, there's been rumors about it being linked to bats. There's been other rumors about being linked to snakes. So they don't particularly have a pinpoint, but further research will prove to where that exact origin is. So public awareness. Public awareness is crucial for wildlife diseases. It will reduce risky behaviors, and it will help facilitate disease transmission, like illegal wildlife trade. It can help with promoting early detection and reporting of outbreaks. It can help support conservation and health initiatives. It can encourage responsible ecotourism and land use practices. And it's helpful for the educational campaigns, community engagement, and media coverage. These can all effectively inform and mobilize the public. And it's super important, especially because it's not typically talked about. You're usually only seeing news reports when something bad is already happening, instead of being told about these diseases before something drastic happens. Instead of being educated, we are informed, and we need to become educated rather than just being informed by the news outlets after the fact. So the One Health approach. There is the approach called the One Health approach. The One Health concept recognizes the interactions between animals, humans, and environmental health. Implementing the One Health strategies involves the collaboration among veterinarians, ecologists, public health professionals, and policymakers to monitor wildlife health, to develop integrated surveillance systems, and to promote sustainable interactions with nature. Some future recommendations is to increase the funding for wildlife disease research and surveillance, to strengthen interdisciplinary collaboration through One Health frameworks, to enhance the public's education and community-based monitoring programs, to enforce the regulation against illegal wildlife trade and habitat destruction, and to foster international cooperation for disease prevention and response. When focusing on public health and moving forward with wildlife diseases and informing the public, we need to be more vigilant in our efforts in keeping the public informed and safe. Ultimately, it's about keeping people safe and also keeping the wildlife safe as well. And conducting more research on wildlife diseases is imperative. In conclusion, wildlife diseases are a multifaceted challenge that demand attention from scientists, governments, and the public alike. By raising awareness and promoting proactive management, especially through the One Health lens, we can be better safeguarded, and we can help with biodiversity. We can help in preventing zoonotic outbreaks and ensure a healthier future for all. So right here, these are the results from the survey that I created. I created a survey, I sent it out, and not everyone that I sent it to completed it. However, the people that did complete it, I decided I'm gonna just use these results anyways. So this was a survey over what their knowledge of wildlife diseases is. So the questions include, there's a shadow now, look on my face. Do you know how many wildlife diseases are active and contagious in the U.S. alone? Do you know how many wildlife diseases are active and contagious in Texas? Have you ever been affected by wildlife diseases? If yes, what wildlife diseases have you been affected by? Out of the wildlife diseases that are common in South Texas, which do you think is most contagious to domestic pets? And out of the wildlife diseases most common in South Texas, which do you think is most contagious to humans? So I asked these questions to people who live in South Texas, and it's not it wasn't a requirement for my survey to ask those who don't really know about wildlife diseases. It just happened to be the people that answered back did not know much about wildlife diseases. But I was happy with the results from this survey. I wasn't happy that they're not informed and that they're not educated about it. But it helps me to prove the point of, even though 5 people answered this survey, those 5 people are not educated on it. So I can only imagine how many more people, if this survey was sent out to a bigger group of people than it was, and more answers do come back than 5. I could not imagine how many more people would not be as educated as you would hope for people to be, especially with wildlife diseases, because they do directly affect us in particular ways. But again, it's not something that is typically talked about in the media aspect of things. So the charts that I just showed y'all are the responses from the survey that I created about wildlife diseases. This goes to show that though only the 5 people that answered, those 5 people were able to fill out the survey, and they weren't informed about wildlife diseases like I talked about. Wildlife diseases and disease transmission should be a more popular topic than it is. Most people are unaware of wildlife diseases, disease transmission, and what diseases can be caught by humans from animals. I'm going to quote Ensel again. The cost of wildlife diseases to public health are enormous and tend to fall disproportionately on BIPOC communities, stemming from poor health care access and structural discrimination. Wildlife diseases impact people all around the world. Being informed shouldn't just be the public's responsibility. There should be forums, programs, and information sessions held in every city, town, county, so on and so forth. Courses that cover and go into detail or contain research examinations over wildlife diseases could be offered at high schools and colleges, though most of the time it is offered at colleges. It's not offered in high school. It's not something that is taught, really. Informing the public is the most important thing because many people go through most of their lives without knowing what wildlife diseases are and what wildlife diseases are even all around them. So yes, you do hear about them on the news, but they don't really tell you everything about them. And that is part of being educated rather than just being informed. And then these are my references. So Ensel, I said Ensel twice throughout the reading of this. And so what that means is the National Caucus of Environmental Legislatures. That is Ensel, and then WHO is World Health Organization that I quoted earlier as well. So thank you so much for listening and watching this presentation, and I hope y'all enjoyed it, and I hope that it inspired you to go and do a little bit of research of your own into wildlife diseases.